Hi, my name is Nicole and I'm a registered nurse here at Monmouth Medical Center. On behalf of our entire team, welcome and thank you for choosing Monmouth Medical Center for your upcoming joint replacement surgery. Please keep in mind this is a generalized class, not based on specific patients or surgeons. So if you do have more specific individualized questions, please reach out to our joint and spine coordinator prior to your procedure. We do suggest that you attend an in-person preoperative class as well, so you receive the most up-to-date information prior to your surgery. Now, some important people on our team. First is our joint and spine coordinator. Our joint and spine coordinator is a great resource for you. They work very closely with your surgeon and can answer the majority of questions that you'll have throughout this whole process. The phone number and email for our joint and spine coordinator is in the educational packet that you received in your pre-admission testing bag. And if you have any questions, again, please reach out. Some common questions that we do get. First is, can I wear my nail polish in the operating room? You can. It's an old myth. You have to take your nail polish off to come and see us. However, we do prefer a light colored nail polish, not a dark one. Two is, should I bring my daily medications with me? So say you take blood pressure, thyroid, cholesterol meds. No, unless specifically told otherwise, please do not bring your daily scheduled medications with you. All we like is a list, just like you brought for pre-admission testing, and we will give you your daily scheduled medications. That also goes for equipment. So say you have a walker from a previous surgery or a reacher grabber, any equipment that we go over today, I'd rather you leave it at home. Use ours while you're here so it doesn't get misplaced with our equipment. Another very important person on our team is our case manager. Our case manager helps with your discharge planning. I'm sure your surgeons have told you that the big trend in joint replacements is let's get people out of a hospital directly back into their home, bypassing that entire inpatient rehab stay, which used to be very popular, but is associated with a higher risk for developing infection after surgery. So we like to get you home, and we like to do so quickly. Most people just spend one night here in the hospital with us. Now, since it's such a quick in and out hospital stay, what most people choose to do is go home with services. Now, what does that mean? That means that we will set up so that a visiting nurse comes out to see you the day after you leave the hospital, even if that's a weekend. And if you needed any type of bandage changes, the visiting nurse would take care of that. We'll also send out a physical therapist to your house to work with you for about 45 minutes to an hour a day, between 3 and 5 times a week for the first 2 weeks. Usually by your 2-week follow-up appointment, you feel ready to get a prescription for some outpatient physical therapy. So if you'd like to go home with services, we will set all of that up for you. We'll do an insurance check, make sure that it is covered by your insurance, and set that up. You don't need to make any other phone calls to do so. The other thing that we'll be asking is, will you need a rolling walker? So everyone starts with a basic walker with wheels after surgery. We don't go straight to a cane, and we never use crutches. We always start with a walker. So if you do need one, we will put that through your insurance and get that delivered to your room before you're discharged from the hospital. You do not need to go out and purchase one prior to coming to see us. And again, if you have one already from a previous surgery, better off leaving that at home to go home to. Now, last but definitely not least are our wonderful volunteers of our program.
Hi, my name is Jeff, and welcome. I trust you'll find the information we share with you today as helpful as I did while I was preparing for my 2 total knee replacements here at Monmouth Medical Center. I'd be remiss if I didn't thank the staff at pre-admissions, the surgical team, and the nurses and therapists on the orthopedic floor for their assistance during my full recovery. As I reflect on my journey, I have one regret. That it took me 12 years from the time I was told I was a candidate for a knee replacement until I had the first one done. However, I was back here 4 months later, had the second knee done, so I think that's a pretty good commentary on how my health and mobility improved as a result of the surgery. Several things I learned along the way, which I think are important, is that commit to your physical therapy. That is so very important. You'll start it here in the hospital, continue it at home, and then at an outpatient facility. You'll spend about 45 minutes to an hour with that therapist, but they'll help you develop a list of exercises for you to do while you're on your own. Stick to that regimen. It'll get you up and moving quickly. Set achievable and reasonable short-term and long-term goals based on your health and your general conditioning. You've probably received feedback from people that have had these surgeries, but this is your journey. Set your own goals. Be kind to yourself and be kind to the people around you. Quite frankly, there'll be days that'll be tough, but just push through it and don't beat yourself up. But more importantly, be kind to the people that are there to assist you. A smile and a laugh goes a long way. Also a thank you. And enjoy the wins. And a win could virtually be anything. A win could be putting your shoes and socks on for the first time, unassisted trip to the bathroom, navigating the stairs in your home. Those little wins will build into bigger things down the road. Assisting me today is my fellow volunteer, Tom.
Hi, my name is Tom, and I'm a volunteer at Monmouth Medical Center, the same hospital that I had my hip and joint replacement surgery, so I can talk with some experience as to this great hospital. It's a wonderful hospital. It's filled with great nurses, physical therapists, and of course, wonderful, wonderful nurses. Regarding the backstory of my knee, for many years I did conservative therapy, which is a very fancy way of saying I put it off for as long as I could. Knee braces, gel shots, cortisone shots, ACE bandage, arthritis cream, you name it, and I did it. And it all seemed to work until it didn't. So finally, just like you, I made the decision to have the surgery. And I'm very glad I did because I had a great recovery. Regarding my hip, I didn't have that much advance notice. It just kind of came on, and I said to myself, I had a great recovery with my knee, so I'm going to have it done right away, and I did. And I'm very, very happy. Now, Jeff mentioned earlier about physical therapy. It's very, very important because the surgeon will come in, take out the old and put in the new, and for the most part, their job is done. However, at that point, it's all up to you. So the more you put into physical therapy, the more you will get back. And there will be days that you don't feel like pushing, or you might have a minor setback. You just can't do as much as you did the day before. That's okay, because a minor setback is a setup for a comeback. So relax, sit back, enjoy the presentation, and note-taking is strongly encouraged. Thank you.
Now, some things to accomplish prior to surgery. Really, the most important thing you do prior to surgery is make an appointment with your primary care doctor, as well as any other specialist that your surgeon wants you to get clearance from. They're going to be using the results from the pre-admission testing completed. It takes us about 2 to 3 days to get back to your doctor's offices. So just give us about 2 to 3 days after pre-admission testing to make any clearance appointments. Now, medications you need to stop. These are important or they could cancel your surgery. If you're on any of them, please note to stop them. At least 1 week, sometimes more depending on your surgeon, so please refer to your surgeon's preoperative packet. But at least 1 week prior to surgery, you need to be off of medications that thin your blood. So some common medications that thin our blood are any anti-inflammatories or NSAIDs. NSAIDs are the medications we love. It's Motrin, ibuprofen, Advil, Aleve, Celebrex, Meloxicam, Voltaren gel. You cannot use at least 1 week prior to your surgery. Now people say, well, if I can't take Motrin or Advil or Aleve before my surgery, what can I take? Your only over-the-counter option is Tylenol or generic acetaminophen, which is absolutely okay to take up until the day of surgery. That could be regular, extra, or arthritis strength Tylenol. Or you can take something stronger. So if you've ever been prescribed Tramadol or Vicodin, Percocet, it's actually fine too. It's just those middle ground meds like Motrin, Advil, Aleve, you need to stop at least a week before. We also like you off of anything with vitamin E in it. Vitamin E actually thins our blood a little bit. So if you're on a multivitamin, we like you to stop that multivitamin at least a week before surgery. If you take some vitamins separately, say you take calcium or vitamin C, that's okay to continue. It's just the multivitamin because of the vitamin E that's in there that we don't like. And lastly, no fish oil or omega-3s and anything herbal over the counter, such as turmeric or saw palmetto. Any herbals, we're just gonna have you stop a week before because we don't know how they'll interact with our medications and anesthesia. Now, there's no dietary restriction, so if you drink herbal tea or eat a diet high in fish oil, that's okay. It's just the actual concentrated supplements we need you to avoid at least a week before. If you're on a prescribed blood thinner, such as Eliquis, Plavix, Xarelto, or aspirin for a cardiac issue, please defer to your cardiologist on when to stop those medications. Those are often stopped closer to the day of surgery. And if you're on any diabetic injections or weight loss medications, those also need to be stopped at least 1 to 2 weeks prior to your surgery, depending on your surgeon. So please default to your surgeon on that as well. We recommend a dental checkup within the last 6 months to a year. The reason why is that bacteria loves metal, and what's going to be in my new joint is some metal. So what can happen is we could start with an infection in our mouth that we have no idea about, and if that bacteria travels into the bloodstream, the first place it's attracted to is that new shiny metal joint. So that's why our surgeons suggest you've seen a dentist within the last year or so, just to make sure nothing's going on in your mouth. It's also very important to let your dentist know after the surgery that you had your hip or knee replaced. Most surgeons want you to be on a day's worth of oral antibiotics for any future dental work that you get done, including just a routine cleaning, because they're using drills in your mouth, which could introduce bacteria, and we want to protect that joint. Now, how long that lasts, that also varies by surgeons. Some say for the first year you'll be on antibiotics for dental work. Others will say for a lifetime. So please refer to your surgeons on specifics for that. Now, some prehab exercises. People often say, are there any exercises that I could start now to make this recovery process a little bit easier? The answer is absolutely, but oddly enough, it's exercises that focus on your arms. And you say, well, I'm getting surgery on my leg. But you will quickly find out that right after surgery and for the first couple weeks, you'll have lost strength in that leg and you won't have the natural ability to just pull yourself on and off a chair or get in and out of bed without relying on very good arm strength to get you up and moving. So Jeff is going to demonstrate on how to do some arm exercises prior to surgery.
Okay, so prior to surgery, you want to focus on building some upper body strength. There's some very simple exercises you can do to accomplish that. The first one's called a curl. You're going to focus on your biceps and your triceps doing this exercise. Now, we recommend using 3 to 5 pound weights, but don't go purchase weights. There's things around your home you can use to substitute as the weight. All you want to do is create a little resistance. For example, these soup cans weigh about 1 pound apiece. A gallon of water weighs 8 pounds. So what you want to do is just find something that offers some resistance while you're doing these exercises. So again, for the curls, simple exercise. You've probably done these before. For the biceps, it's this motion like this. For the triceps, the muscles in the back of the arm, it's this. Now, we recommend that you do this 3 to 4 times a day, maybe 10 to 20 reps. Don't fatigue yourself. Put the weights aside, but it's important that you do some workouts before your surgery just to build some strength in your upper body. Another good exercise is called a chair push-up, and this one's a little tougher than the curls. What you need to do is find a chair that's in your home that's stable with arms on it. You sit yourself in the chair, and I'm going to say it's my right leg that's had the surgery. I'm going to extend it today, and all you simply do is push off and on the chair. Now, this is a good exercise for your shoulders, but it's a little tougher than the exercise with the curls. We recommend, again, 3-4 times a day, maybe 10 reps per session. Again, if you find yourself tired and fatigued, just stop. Go back to it later. But as much exercise as you can do prior to your surgery will help you with your recovery.
Now, some lower extremity exercises. These are very simple because we like you to do them as soon as you get out of the operating room and in between therapy sessions at home. Not only will they help to build up some strength that you've lost during surgery, but they prevent you from developing a blood clot. You guys are actually considered at a little bit of a higher risk for developing a blood clot for the first 6 weeks after surgery. So if you're not on a blood thinner now, we actually put you on a blood thinner for the first several weeks after surgery, which I'll go over at the end what your surgeon will use. But for those first several weeks, you want to be mindful to keep your body moving. All I mean by that is when I'm sitting on my recliner and watching TV at home, you want to be mindful to be doing ankle pumps. So just press your toes, toes to your nose, press the gas, toes to your nose, ankle rotation, just to keep everything circulating while you're in bed. One of the best and easiest exercises for my knee replacements. Knee is where you lose your strength after surgery. It's your quad. It's that thigh muscle you really have to work to build back. And a simple way to do that is when you sit, you'll find you sit with a natural bend in the knee. Try to get the back of the knee to the flat surface by squeezing that thigh muscle. So back of the knee to the flat surface by squeezing that thigh. And hips lose more glute strength, so just squeeze your bum and let go, squeeze your bum and let go while you're in bed. Again, simple exercises you could do really as soon as you get out of the operating room and in between physical therapy sessions at home. Now, what can you expect from physical therapy here in the hospital? Don't be surprised when an hour or two after you get up to the orthopedic unit, you get a little knock at your door from your nurse or therapist saying, all right, let's get you up and start moving. We want you up and out of bed very quickly after surgery because you'll find that a new joint gets very stiff quickly. So getting up frequently is important to prevent stiffness. Our doctors don't use Foley catheters, that tube that drains the urine in the bladder like they used to years ago, which means you got to get up, start going to the bathroom that first night as well. Each day while you're here with us, you'll have up to 2 rounds of physical therapy. We have a gym that's right on the orthopedic unit, and in the gym there's going to be stairs to practice going up and down, a bed to practice getting in and out of, a tub bath, even a car simulator, really to make sure you guys feel safe and ready to be discharged home. So we'll do physical therapy here in the hospital, and then your in-home therapy will start the very next day after discharge. Now, walker. Everyone, like I mentioned, starts with a rolling walker. We don't go straight to a cane, and we never use crutches throughout this whole process. Again, if you don't have a walker, we will put that through your insurance and get that delivered to your room before you leave. And if you have one already, you could leave it at home. Now, as crazy as it sounds, there's actually a correct way to use a walker. And you think, well, it's just a walker. How hard could it be? Well, what everybody does, and it's very natural, is my leg is weak after surgery, which is normal. So everybody naturally takes their walker and they pull to try to get themselves off their chair or their recliner. That's actually a horrible habit to get into. You could easily fall getting up that way. So instead, I always want you to push off your stable surface. Now, a stable surface really is anything. It's a bed, a chair, a toilet seat. That's why coming in with good arm strength is important. We always push off our stable surface, then grab onto your walker, and whether you're a hip or a knee replacement, you guys will be full weight bearing even from the first time you get out of bed, which means we actually want you to put as much weight as you possibly can on that surgical leg as well. And the correct way to walk after surgery is, surprisingly, walker, the operated leg goes first to force the weight on it, then non-operated. So it's walker, operated, non-operated, walker, operated, non-operated. Now, most people will transition from a walker to a cane. There is no magic timeline on that, though. It's very individualized, and it will be your physical therapist, whether that's your in-home or outpatient therapist that transitions you. Keep in mind, most insurances do not cover both a walker and a cane. So if they're buying you your walker, then you're better off getting a cane at like a surgical supply store or online. Now, for my knee replacement, you're going to hear us talk a lot about range of motion after surgery because accomplishing good range of motion is really the most important thing you do following this procedure. A common complication after surgery could be winding up with like a stiff knee, or some people call it a frozen knee. What that really means is all that scar tissue built up, and if you weren't really bending it enough, you're going to feel like you're almost like stuck a year down the road. So the average knee replacement can expect at least 6 weeks of physical therapy following a knee replacement. Most people do 2 weeks doing that in-home physical therapy, followed by at least 4 weeks of outpatient physical therapy 3 times a week, really working on range of motion. But again, expect at least 6 weeks of physical therapy following a knee replacement. Now, my posterior hip replacement. So if you're a posterior hip replacement, you do have a few rules after surgery. Now, these rules do vary based on your surgeon, so you want to speak to your specific surgeon on how long that they'll have you follow these. So your rules are no bending past 90 degrees. So that means if something dropped on the ground, you could go to about your hip level, but I wouldn't want to just bend over and grab something off the floor right away. Same thing, if I was sitting in a chair like this, I wouldn't want to just bend over and grab something. You don't want to sit in anything too low, and that's probably the most important one. Now, what is too low? If your knees are even with your hips, like an average chair, the way we're all sitting, we're fine. But if your knee pulls higher than your hip, you're sitting on something that's too low. The most common place we see that is actually a toilet seat. So as crazy as it sounds, before surgery, please check your toilet seats. If you have a low toilet seat, especially if you're on the taller side, you're gonna wanna go out and get a raised toilet seat or a raised commode prior to surgery. Most insurances do not cover them, so you would have to get one on your own. If you have a low couch or a low recliner, just put a firm pillow underneath your butt. Now my knees are even with my hips and I'm fine. Also, avoid sitting with your legs crossed right after surgery, and avoid sitting with your legs toed in or out. And people say, well, when would I do that? Sometimes you get tired and you let yourself rotate like this. You wouldn't want to sit in that position for too long. Again, how strict your surgeon is with those restrictions and for how long he'll have you follow them is very individualized. So if you have any specific questions, please feel free to reach out before surgery. Now, I gave my hip some rules. What about my knee replacements? This actually goes for everyone, both hip and knee replacements. We do not like you to pivot or twist right away on your implant. You're going to sprain or strain some of that healthy tissue healing around it. So really what that means is, say I'm walking with my walker and I want to make a turn back to my room. Don't twist on your implant, and instead it's little baby steps and then start walking again. That's also not forever, just the first couple weeks as everything's really healing around the implant. But other than that, again, we're full weight bearing on our surgical leg, and we always lead with our surgical leg when we're walking. Now, potential equipment needs. Like I mentioned, usually the only thing that insurance covers for you guys is that rolling walker. Everything else I'm about to show you is considered helpful, but not technically necessary. So you would have to go out and purchase these items either at a surgical supply store or online. So as crazy as it sounds, one of the hardest things to do after the surgery is get your socks on. And you think, really? But my hips usually don't have that range of motion to get your leg up like that. My knees, I'll be honest, you have so much stiffness and swelling right after surgery, you might not be able to get your leg up that high afterwards. So to easily get your socks on, there's something that's called a sock aid. So it's a little device you put your sock on. I'm going to throw it out like a fishing line and put my foot in and then pull up on it. So that's how I get them on. To get them off, I would do the exact same thing in reverse. So I have my little dressing stick, and that dressing stick has a hook on the end of it, so you don't have to get your leg up like that. I could easily get out of my socks or wiggle out of my clothes those first couple weeks when you are stiff and swollen. So that's a sock aid and a dressing stick. Another great piece of equipment that I'm sure many of you have seen is a reacher grabber. They're wonderful and very helpful. Again, you're on a walker those first couple weeks or days after surgery, and you won't have the balance and stability to be grabbing things safely off the ground. So a reacher grabber makes it much easier to safely be independent at home. A leg lifter. People often tell you that after surgery, their leg felt very heavy afterwards. Now, that makes a lot of sense because of all the swelling, not only around the surgical site, but there'll be a lot of swelling down the entire leg for the first couple weeks after surgery. Because of all that swelling, the leg will feel much heavier the first couple weeks after. When the leg is heavy, it's often difficult to have the strength to get your leg in and out of bed or on and off a couch by yourself. So to assist you with doing so, there's something called a leg lifter, where I take my little leg lifter, lasso my foot, use my good arm strength I've been practicing before surgery to get my leg into bed. To get it out, I would do the exact same thing in reverse. Now you can go out and purchase a leg lifter, but you don't have to. There's actually a lot of household items you could use to make one. So I have one here made out of a bath towel. You could use a dog leash. You could use a belt, the back of a cane. There's a lot of things that you could use to get your leg in and out of bed. I just don't want you to be concerned if it is difficult those first couple weeks until the swelling really starts to go down. Now, Jeff is going to go over some shoe wear.
As Nicole mentioned, getting in and out of your shoes and socks can be challenging. She mentioned a sock aid. Well, you can consider this extended shoehorn a sock aid for your shoes. You lack that range of motion and flexibility, so you can use that shoehorn to get in and out of your shoes. If you have shoes with laces that you just can't part with, you can purchase these elastic shoelaces. Essentially what it does, it makes every shoe into a loafer. Again, what you want to do is have the loosest fitting shoe that you possibly can get in and out of. Probably the best solution is a slip-on shoe. There's a number of those shoes on the market, but it alleviates the need to be able to have to bend over and slip in and out of a shoe. So a slip-on shoe is a great solution.
And a lot of people ask me about showering. Do I need to sit in the shower after surgery? Most people will have the strength to shower after surgery, and you are allowed to shower 3 days after your surgery. The bandages are waterproof. However, I do strongly suggest that if you do not have a handlebar or something to hold on to get a suction cup grab bar for the tile, because although you have the strength to stand, it's more for balance to have something to hold on to after surgery. And a lot of people will get one of these long-handed sponges after surgery. Again, you're stiff, you're swollen, might not be the easiest to get washed up, so it makes it a little bit easier after surgery. And I know I did mention about the posterior hip replacements, that you don't want to send anything very low after surgery and to look into getting a raised toilet seat. Often my knee replacements will say, do I need a raised toilet seat? So technically the answer is no, because you are allowed to bend after a knee replacement. However, if you ask anyone that's had this surgery before, they're going to tell you that the lower you have to go, the harder it is to get up after any surgery. So I'll be honest, if you have a low toilet seat and you're on the taller side, getting a raised commode or a raised toilet seat, especially with handles on the side, does make it much easier to get up after surgery. And again, any of those items can be purchased either at a surgical supply store or online. Now, stairs. Stairs are probably one of the biggest concerns that people have coming into surgery is, I have a flight of stairs, can I do it? You absolutely can. You are not hurting your new hip or new knee by going up and down stairs as soon as you feel comfortable doing so. However, there is a correct way to do so without hurting yourself, so Jeff is going to demonstrate it on our little stair here.
Okay, steps are definitely can be intimidating, but they're definitely doable. In fact, what you're going to have to do on the orthopedic floor before you leave from the hospital is demonstrate to the therapist that you can use the steps. So most of us have been going up and down the steps, alternating steps for a very long time. Unfortunately, you're not going to be able to do that due to the lack of strength and flexibility in that surgically repaired leg. So there's a really easy way to get up and down the steps. And all you have to remember is up with the good, down with the bad. And simply what that means is that the good leg, the leg that has not had the surgery, is going to do all the work on the stairs. So I'm going to use this handkerchief to mark the leg that's had the surgery, and today it'll be my right leg. So simply what you do is up with the good, meaning go up the steps with the good leg, and the surgically repaired leg trails behind. So up with the good, and when you go down the steps, you just do in reverse. Lead with the bad leg. Again, all the weight's on the leg that's not had the surgery. So down with the bad. Up with the good, and down with the bad. Now go home and practice this before your surgery so you feel comfortable doing it. What you want to do is make sure the railings in your home are secure, because you're going to need them for confidence and for balance. Again, practice before you go home, and maybe the first time or a couple times after your surgery, have somebody spot you on the steps. But be very careful. It can be dangerous on the steps, so just be careful. Best way to spot somebody is have them apply a little pressure on the middle of your back as they're going up the steps. If you start to lose your balance, they'll be able to tell you that you're losing your balance and help you steady yourself. If they're watching your upper body or your shoulders and your shoulders start to roll, you're going to be in a position where you may fall over. So again, go home and practice it. Secure your railings, and you'll be able to do the steps quite easily.
Now, what to pack? I already told you what I didn't want you to bring. I told you not to bring your daily medications or any equipment you either have or choose to purchase before surgery. So what do we want you to bring? Less is more. You don't need to overpack to come to the hospital. All you really need is one pair of loose-fitting clothes. For my knee replacements, shorts or a very loose-fitting capri or pants are better. Knees tend to swell right away. Hips, as long as you have an elastic waist, you're fine. It is usually chilly in the hospital, so I do suggest bringing a sweater or a robe for on top. As far as shoes go, most people use our little yellow socks while you're here in the hospital. To go home with though, just like Jeff mentioned, you want to bring the loosest shoes you own. That whole leg will swell, including the feet, the first couple weeks, so you want a nice loose shoe to go home to. Feel free to bring your toiletries like toothbrush, toothpaste, deodorant to get up and washed in the morning. I want you to bring back your Incentive barometer, which is this little breathing tool you're going to get in your pre-admission testing bag. And feel free to bring your cell phones with the charger, a tablet, a book, something to do in the downtime that you're here. That bag will go in a locked locker while in the operating room, and then we'll come up to the orthopedic unit with you after. Now, that breathing tool. That breathing tool is used, and you might have seen it for other surgeries, to prevent post-operative pneumonia. After surgery, you lie in bed or you lie in a recliner, a lot more than you're doing right now. If you're lying around, you don't take big, deep breaths. If you don't take big, deep breaths, you could get fluid built up on your lungs, which could cause a fever, but down the road turn to pneumonia. So to prevent any of that from happening, we give you this little tool to use before and after surgery, and Jeff is going to demonstrate how to use it.
So inside the package you'll get at pre-admission today will be this Incentive spirometer. And think of this as an exercise machine for your lungs. What it does is measures the flow of air in and out of your lungs. The most important thing to remember about using this tool is that you're measuring your inhale, not your exhale. So there's actually a couple parts. The first one is this tube. So what you do is extend the tube, and think of this as a straw, and you're going to be using it like you're drinking from a glass. You attach the straw/tube to the bottom of this little base here. Now you notice there's a couple moving parts on the spirometer here. The first one is this cylinder with a bunch of numbers on it. That's your goal. The way you determine your goal is refer to the chart inside the package. Now I happen to know from the chart, the chart has male and female, and you would look at your height and your age to determine your goal. I happen to know my goal is 2,500, so I'm going to set the arrow on 2,500. I'm pretty confident I'm going to hit that goal today. But you know what's important as you're using this tool in preparation for your surgery is to get a baseline, understand what you can achieve. If you can't hit your goal, that's fine, but practice is probably the most important thing with this tool. So again, you've got the cylinder, and you also got this arrow on the side here where you can set your goal. Now you notice there's a little button that's rattling around on the side. That's probably the most important part of this tool, because when you take that nice steady breath in, what you want to do is keep this button between these two arrows. The way you use the tool is you purge all the air out of your lungs. Take a nice deep breath, sucking through this tube/straw, and keeping the button on the side here between these two arrows. Again, a nice steady breath versus a burst of air. What you do is purge the air out of your lungs, take that nice steady breath in, keeping the button between the two arrows. When you can't take in any more air, hold your breath for 3 seconds and then exhale. So. Now we recommend you start practicing with this tool, to establish that baseline. But for sure, 3 days before your surgery, use it 3 times a day. Breakfast, lunch, and dinner, easy way to remember it. Maybe 10 times per session. If you get dizzy or lightheaded, put it aside and come back to it, but practice really helps with this. Bring this tool back to the hospital with you, and we'll have you doing it 10 times an hour while you're awake.
Now, another piece of homework for you guys are some supplements that we suggest that you begin about 2 weeks prior to surgery. So about 2 weeks prior to surgery or more, we strongly suggest you start taking some daily vitamin C. Vitamin C helps promote wound healing, and it makes you feel a little bit better after your surgery. If it's in that multivitamin, that's wonderful. But we're stopping our multivitamin at least a week before surgery because of the vitamin E that's in there. So we suggest vitamin C daily. We also suggest taking a daily, at least once a day, iron pill. Some surgeons do suggest taking it twice a day. The reason why is that it's inevitable that you lose a little bit of blood during surgery. It's normal and it's expected. But we like you to start with a nice amount of iron in your body to prevent you from feeling anemic or sluggish after surgery. So iron at least once a day, 2 weeks before surgery is a nice way to build up those iron stores. Now, iron is great, but it does cause one terrible side effect for most people, and that's constipation. So if it does affect your stomach, take a stool softener. We suggest Colace. However, any over-the-counter stool softener like Miralax or Senecot is fine as well. So again, about 2 weeks before surgery, vitamin C, iron, and a stool softener. If the iron's affecting your stomach, you could continue taking those up till the day of your surgery. Now, the day before your surgery, if your surgery is a Tuesday through Friday, expect your phone call on what time to report to the hospital the day before. If your surgery is a Monday, you'll get that call the Friday before. Please keep in mind those phone calls do happen after 3 p.m., usually between 3 and 5. So again, you'll get that phone call between 3 and 5 the day before on what time to report to the hospital. We'll have you come in about 2 hours prior to your scheduled operating room time here. Now, after you get that phone call, what time to come in, it's now time to cleanse before my surgery. So this does depend on your surgeon. There are 2 types of products that we can use to cleanse before your surgery. So you will receive an instruction sheet in your pre-admission testing packet, and it's a double-sided sheet because, again, this does depend on the surgeon. So if you go to Seaview Orthopedics or you have Dr. Dickerson, you're going to use this side of the paperwork, which has this little body wash on there. You will get this body wash from the office. The instructions are here, but in general, they are. You're going to get into the shower the night before surgery. You could use whatever you'd like from the neck up, but instead of using your regular soap or body wash, use your antibacterial body wash from the neck down. Go to sleep. The next morning, repeat the exact same process. Get back into the shower, use whatever you'd like, neck up, but instead of using your regular soap, you're going to use your antibacterial body wash from the neck down. So that's for my Seaview Orthopedics. If you go to Professional Orthopedics, you're going to use this side of the paperwork, which has this little man diagram. Again, details are listed there, but in general, the instructions are you will get 2 sets of wipes. One is for the night before, one is for the morning of. Does not matter which one is which. Night before surgery, you're going to shower normally. Use whatever you'd like on the entire body. Get out of the shower, dry off, wait about an hour or 2. After about an hour or 2, you're going to take out one of the packages of wipes, open them up, and wipe down your whole body from the neck down. Go to sleep. The next morning, you do not shower. All you do is take out your second set of wipes, open them up, and wipe down your whole body from the neck down in them. So that's using the body wash or the wipes the night before and the morning of. Again, big difference really is with the wipes, you do not shower the morning of. After that, you are now considered cleansed before your surgery. Nothing else on your body, no body lotions, creams, perfumes, no deodorant, nothing on the body. And all jewelry, including wedding bands, should be coming off prior to your surgery. In pre-admission testing, we'll be swabbing you for MRSA. MRSA is a bacteria that could cause a staph infection after surgery. If you test positive for that swab, which is common, your surgeon's office will call you and call an antibiotic ointment that goes in both nostrils 5 days before surgery. If you test positive for that swab, the instructions are located in your educational packet. So if you test positive, the instructions are located in your educational packet. If you test negative, nobody calls you about that swab. So if you test negative, you're just doing the body wash or the wipes the night before and the morning of. Now, the day of your surgery. So there is an instruction sheet that's in your packet that will outline this as well, but you could eat or drink whatever you'd like up till midnight of this procedure. At midnight, you can now have clear liquids up until the time you leave for the hospital. Clear liquids would be water, Gatorade, apple juice, Italian ice, Jell-O is fine to keep taking up until the time you leave for the hospital. In addition to those clear liquids, you will get a drink called Ensure Pre-Surgery in pre-admission testing. We like you to drink this drink within the hour prior to leaving for the hospital. This is a special drink that's high in carbohydrates to help you make you feel a little bit better after your surgery. So again, you could eat or drink whatever you'd like up till midnight. At midnight, you're going to switch to clear liquids. And in addition to clear liquids, you're going to drink this entire drink within the hour before leaving for the hospital. Once you leave for the hospital, nothing by mouth. No water, no liquids, nothing by mouth once you leave for the hospital. On that instruction sheet, there are some extra details. One of them being we do not like the color red, so please avoid any red Gatorade, red Jell-O. Also, this drink is a little bit high in carbs, so for our diabetic patients, we want you to drink it the night before surgery, before bed, and not the morning of. Again, more details are on that instruction sheet. So we're doing that the morning of. We're also using our body wash or our wipes the morning of surgery as well. Just wear comfortable clothes to come and see us. You could park in the main parking garage at the main entrance of the hospital. Come into the front desk. They're going to stop you, ask you where you're going, and just let them know you're going up to the operating room, which informationally is our 4th floor. How long will your surgery last? About 2 hours. So again, we had you here about 2 hours prior to your surgery, and your surgery will be about 2 hours as well. Your family will stay updated throughout the process, getting a phone call from the surgeon when your surgery is over, and then they'll get a call from the nurse in recovery when you leave recovery and head up to the orthopedic unit. It's on the orthopedic unit that your family can visit you, and we'll discuss the latest visitation during pre-admission testing. Now, pain. Many people wake up from surgery and they say, wow, I feel great. I have very little, if any, pain at all. And that's wonderful. But there is a block that's still working. Now, what is a block? What is your surgeon talking about by a block after surgery? A block is similar to Novocaine. So the same way your dentist can inject Novocaine into a tooth before they fill a cavity so you don't feel anything. We take something similar to Novocaine, inject it around the surgery, so you wake up with very little, if any, pain at all, which is great. But the block will wear off, and for most people, it wears off the 2nd day after surgery. So often you feel really good the day of surgery and the day after, and it's very normal and expected to take a step back the 2nd day. Honestly, I think the 2nd day can be a little bit tough because you have to realign your pain regimen, and then each day thereafter will improve. So what do we have you take for pain? Please have a big bottle of extra strength Tylenol or generic acetaminophen at home, because we usually like you to take that around the clock for the first week or so after surgery as a base of medication. On top of that, we will prescribe you a narcotic. Usually that's oxycodone or tramadol. It does vary from person to person, that you could take on top of the Tylenol if needed. If you've ever taken narcotics for surgery before, you will have found out that the biggest side effect of the narcotics is constipation. Please have a stool softener like Miralax or Colace at home, because whenever you're on narcotics, you always want to be taking a stool softener to prevent constipation. Now, anesthesia. Most people will not go under general anesthesia for this procedure. During general anesthesia, you're fully intubated and asleep during it. Instead, most people get a spinal or an epidural for this process. That's that needle they put in your lower back to numb you from the waist down. They do also put you to sleep, but it's like if you've ever gone for a colonoscopy. You're not intubated, you're not put under general anesthesia for a colonoscopy, but you're absolutely asleep. I tell you about the spinal because most people will wake up and still be numb from the waist down, and I just don't want you to get nervous. That's very normal and expected. Usually takes a couple hours for that numbness to wear off, and then we could start getting you up and out of bed after surgery. Now, my posterior hip replacements are going to be modeling this pillow when you wake up from surgery. It's called an abduction pillow, and it prevents you from breaking those restrictions like crossing your legs or toeing in or out as you're waking up from the surgery. If you find this to be a little cumbersome, you can take it out and make it smaller by putting it like this, or just a regular pillow is plenty. You can take this home with you, or again, a regular pillow between the legs so you don't cross is fine as well. Now, for my knee replacements and my anterior hips, you guys will be waking up with an ice pack wrapped around the incision. It will look similar to this. This is called a Polar Care, and it's a continuous ice machine that will stay cold for about 6 to 8 hours. It's going to be, again, wrapped around the incision, and it helps with both pain and with swelling. A couple very important things with this: it does get extremely cold. It should never go on your bare skin. I like something thin like a pillowcase, a dish towel, an ice wrap, or even your pants between the ice and the incision. Also, this runs through a lot of ice, which can be a little bit annoying for most people. So what a lot of people have told me that they do is they freeze water bottles. I think the 12-ounce water bottle is the best size for it. If you freeze 12-ounce water bottles before surgery, you could put 6 at the bottom and cold water on top of that, and then keep just swapping out the water bottles. That way you don't have to keep running through all that ice. So kind of a little workaround that patients have told us along the way. Now, posterior hips won't have an ice machine because you don't have as much swelling, but you could absolutely put ice on the incision. For both hips and knees, we love ice, we hate heat. We don't put any heat on our incisions for about 4 to 6 weeks after surgery. And again, if you do have this, you will go home with this ice machine after surgery. Now, for my knee replacements, your nurse is going to keep coming in, taking a bath towel, rolling it up like this, and putting it underneath your ankle. The reason why we do that is when you put something underneath your ankle, you're going to feel a nice stretch or a pull in the back of your leg, because getting your leg straight after a knee replacement is just as important as getting it bent far back. Never put anything underneath the knee itself, because although it feels good to hang like that, that's how our scar tissue is healing. So during the day when you're resting on your recliner, always good to have that roll towel underneath the ankle and nothing underneath the knee itself. Now, I talked at the very beginning about blood clots. So you're considered at a little bit of a higher risk for developing a blood clot within the first 6 weeks after surgery. So we do a lot to prevent you from developing a blood clot. First thing that we do is use these compression stockings. They're called compression stockings. They're tight white stockings. They prevent swelling in the calves. They go on during the day. They come off at night, both legs between 2 and 6 weeks, depending on your surgeon. You can wash them with soap and water and let them air dry after use as well. You'll also wake up with these wrapped around your legs. They're called Flotrons or SCD. They pump air on your calves. It feels like a little massage on your calves. That's only while you're here in the hospital. You don't go home with those. You just go home with the compression stockings. And then everyone will go home on a blood thinner. So if you're on a blood thinner now, like Eliquis, Plavix, or Xarelto, you'll go back on that same blood thinner. If you're not on a blood thinner now, you will be put on a blood thinner. That is surgeon dependent. It could be aspirin, either 81 or 325 milligrams, or it could even be Eliquis or Xarelto, depending on the person. Again, this is more specific based on surgeon and the individual, so it'll be discussed while you're here in the hospital. But you can expect to be put on a blood thinner after your surgery. On discharge, we're going to go over some discharge instructions together. We do suggest that family is present during discharge instructions, so you have another set of ears there. But some common questions are, what does my bandage look like after surgery? This is the bandage that most of our surgeons use, so it looks very similar to that. You can get an idea of the size of the incision as well. This bandage is wonderful for many reasons. One, it is a waterproof bandage. You can shower at the very least 3 days after your surgery, sometimes sooner, depending on your surgeon. And most surgeons will have you keep this bandage on until your follow-up appointment with them. So it's very simple now. There's not scheduled bandage changes. If the bandage needs to be removed and changed, you can have that visiting nurse come out and do that for you. But that's the bandage, again, that most surgeons will use. Our doctors use dissolvable stitches with a skin glue to close the incision so there aren't staples or sutures to be removed from the surgical site. Most of the day, you want to be very mindful to keep your legs up and elevated. Everybody swells after surgery, and the worst place we could sit is with our legs down like we're all sitting now. Instead, get our legs up and elevated. If you have a recliner, that is absolutely where you're going to find the most comfortable. Some people love recliners so much that they rent recliners for this surgery. Often surgical supply stores are available to rent a recliner for like a month's time because it's much easier to get on and off a recliner than it is to get in and out of bed. If you don't have a recliner and you don't plan on renting one, then a couch with an ottoman or in bed is preferred than sitting in a chair with your legs down. Remember, what we could do to help with swelling is ice, elevate, and it will take time. It will take several weeks for that swelling to really go down. As far as driving goes, if it's your left leg, if it's your non-driving leg, you have to be off of narcotics and cleared by your surgeon. So it's usually about a 2-week period. If it's your right leg, if it's your driving leg, you have to be off of narcotics and have the strength to, slam on a brake if needed. It's actually usually your physical therapist that tells you when that you're ready to start driving. And I've seen that range anywhere from like 3 to 6 weeks even. Again, that's very individualized. As far as getting on an airplane, most surgeons will have you wait about 4 to 6 weeks before getting on an airplane. This implant does have metal in it. You will set off a metal detector from here on out. Years ago, they gave out like a card that said like, hi, I have an implant. Most surgeons don't give out that card anymore, but you should always let them know you've had your joint replaced before going through a metal detector. And I know that I said you could shower 3 days after surgery. However, no tub baths, swimming pools, hot tubs. Do not submerge the incision for about 4 to 6 weeks. That also goes for any anti-scarring ointments. We don't like any ointments on our incisions for about 4 to 6 weeks unless told otherwise by your surgeon. And I always like to end the presentation saying that even though this is a common surgery now and it's a quick in and out hospital stay, again, the average patient just spends 1 night here in the hospital, it's still a major surgery with a 6 to 12 week full recovery. So please be mindful along the way that it is a 6 to 12 week recovery after this surgery. To Jeff and Tom's point, be kind to yourself along the way. You'll do great, but you have to give yourself time to heal. If you do have any questions regarding this video or get any more surgeon-specific information, please reach out to our Joint and Spine coordinator prior to your procedure with us.